Hi guys, this is your family physician Dr. Aditya Bapuji, certified in rheumatology from Pune, immunology from Harvard Medical School, and diabetes management from Apollo Hospitals. So today I'm here to discuss a very interesting topic. So continuing with the solutions to lower back pain, a lot of people ask me what kind of, how do I manage pain, or what kind of exercises to do, and where should I sleep? And there are so many doubts, patients come up with, and we also face these kind of questions. See, now as far as sleeping is concerned, see, lower back pain is usually 90% of the cases, like I said in my previous video, that it is mostly mechanical. It is because the muscles in the lower back become stiff. Now, stiffness basically is induced because of bad postures, or it could be because of lack of exercises or doing the wrong kind of exercises. Now, as far as postures are concerned, see, sleeping on a hard surface, literally a very hard surface, is something that is back friendly. So I've seen a lot of marketing that goes on for back pains. People come up with different kinds of mattresses. They have spring mattresses. They have U-foam mattresses. Different kinds of mattresses. You don't have to buy or invest in anything fancy. What you can do is, if you have a plywood cot, and if it has a thick mattress, please get rid of the thick mattress. When I say thick mattress, anything above 1.5 inches is considered thick and not good for the back. So what you can do is, you can replace the existing mattress with a cotton mattress that is about, say, 1.5 inches in thickness, and that will give you all the support your back needs. See, how many ever exercises you do, if you are somebody who is going to spend 5 hours or 6 hours sleeping on a thick mattress, your stiffness and pain will come back in the morning when you wake up, and you will feel it. So it is very important to change the mattress. That is something very, very important. Now, coming to the exercise and sitting posture. So sitting posture, see, including me, most of us, we spend our day sitting, whether it's at work or at home, whether you're watching TV or reading a book or whatever you're doing, even for a leisure activity, sitting posture is very important. You don't have to buy any fancy ergonomic chairs, and all that is not required. All you need to take care is that whatever surface you sit on, it is not very smooth, so that you don't slip. So that is something very important. Otherwise, when you tend to slip in the front, the support in the lower back goes for a toss. So that is something very important. Secondly, your chair or the surface on you that you sit on should have an armrest. That is something important. And the backrest also should be a firm one. It should not be a flexible one. If you have an option of locking the backrest, then that is the ideal thing to do, because that is what will give your back support. That is something important. Now, as far as exercises are concerned, see, there are different kinds of exercises. There's a lot of confusion among trainers. There is a lot of confusion among physiotherapists that one should not bend forward, because they would have diagnosed you with a slip disc, or they would have diagnosed you with stiff back, whatever it is. See, spine has got dual functionality, where it bends back and it also bends forward. So we basically ask you to stop repetitive forward bending activities, because if you don't have backward bending flexibility or strength, okay, and you do repetitive forward bending activity, something like, say, abdominal crunches or any other workout that involves you to bend forward, that can cause stress on the spine, and it can only increase your pain and the chances of increasing the disc prolapse. So it is very important to strengthen the spine, the extension, the muscles that come into play during extension, and also focus on flexibility. Flexibility is something that is very important. How many ever strengthening exercises you do, whether it's a resistance band or whether it is using weights, what happens is the muscle shortens. When the muscle shortens, it becomes stiff, it induces stiffness. So strengthening is important, followed by flexibility exercises. So in my next video, or I will share a link where you can view some of the very if you can spend 10 to 15 minutes of time doing flexibility exercises initially, later on you can start with strengthening exercises. So flexibility is something very, very important. So I will share a link, or I will share it in the next video. Thank you.